Hello, my dear friends. I welcome you all to my daily dose. So, I'm myself Dr. Rajesh Gubba. I'm a cardiologist and I'm also the mentor for teaching general medicine for exams like NEET PG, AIIMS, PGI, and as well as JIPMA. So, as the part of today's daily dose, I have a 54-year-old woman. She presented with history of the weight loss of appetite, and shortness of breath. Her respiratory rate is 19 per minute and oxygen saturation it is ranging in between 93 and 95%. And on examination there is reduced air entry, dullness to the percussion on lower to mid zones of the right lung. There is also reduced chest expansion on the right. From the list below, select the most likely diagnosis. The question asked is most likely diagnosis. The options are right middle lobe pneumonia, pulmonary embolism, right-sided pleural effusion, right-sided bronchial carcinoma, right lower lobe pneumonia. So this is the question, little tricky question, right? And most of us will go with two options and we will fight in between these two options. That is your right-sided pleural effusion and right-sided bronchial carcinoma. But what exactly is the answer here is the right-sided pleural effusion. So let me substantiate why it is right-sided pleural effusion, why not right-sided bronchial carcinoma, and why not the other options. First of all, let me tell you the points in favor of the pleural effusion. See, if you take the history of the individual, loss of weight, loss of appetite, and difficulty in breathing. Now, loss of weight, loss of appetite, that is usually seen in patients with a carcinoma, right? Any malignancies. But this carcinoma is the one which can cause the pleural effusion. Bronchial carcinoma is the one which can cause or which can make the individual to land up in pleural effusion. So pleural effusion is one of the complication with your bronchial carcinoma. And what type of pleural effusion you will have in patients with bronchogenic carcinoma? That is exudative type of pleural effusion. Now, that means even in patients with a pleural effusion also, with underlying cause as bronchogenic carcinoma, the individual can have loss of appetite and as well as loss of weight, right? Next, and you take like for example, if it is a tuberculous pleural effusion, there also you can have loss of weight and as well as loss of appetite. Okay, so it doesn't mean that if there is loss of weight and loss of appetite, it should be bronchogenic carcinoma. Now, what are the points in favor of your pleural effusion? First and foremost, very important point, dullness on percussion. Right, dullness on percussion from lower to mid zone is a very important point in favor of your pleural effusion. And the other important point is decreased chest wall movements. Right, decreased chest wall movements. This is another important point in favor of your pleural effusion. So most likely the diagnosis is your right-sided pleural effusion. Now, how to substantiate this from the bronchial carcinoma and as well as pneumonia? Like for example, you take in patients with pneumonia, that is your option A and E, that is right upper lobe pneumonia and right lower lobe pneumonia, and as well as your bronchogenic carcinoma. All of them, they will lead to your exudative type of pleural effusion. But what you should remember is, in initial stages of this particular disorder, that is bronchogenic carcinoma and as well as pneumonia, they will have bronchial breathing over the affected area of the lung. So, but what is that given to in our question? In our question, it has been said that the chest wall movements have been reduced and there is dullness to the percussion. But anyways, the bronchial breathing or breath sounds is being reduced is not being mentioned in your question. The auscultatory finding is not being mentioned in the question. But what is the point against your bronchial carcinoma here? Let me tell you another important point. You see, he has given you right-sided bronchial carcinoma, but it is not being mentioned clearly whether it is right upper lobe, right middle lobe, or right lower lobe bronchial carcinoma is not being mentioned. But whereas if you take the pleural effusion, the fluid will start accumulating from the costophrenic angle, from the lower part of the lung, and then gradually it will progress to the mid zone of the lung. So the dullness to the percussion, he has clearly mentioned from lower to mid zones of the right lung, and that is the reason why the answer will become right-sided pleural effusion. And if you would have been mentioned right-sided bronchogenic carcinoma of the lower lobe, then that would be the point of little confusion whether to decide bronchogenic carcinoma or pleural effusion. But anyways, it is not being mentioned in which part of the lung right bronchogenic carcinoma is there. We can rule out this particular bronchogenic carcinoma, right? And in case of your right middle lobe pneumonia and as well as right lower lobe pneumonia, the individual will have bronchial breathing, even though that is not being mentioned, but the points in favor of your right pleural effusion are more compared to that of your pneumonia. You take pulmonary embolism. In pulmonary embolism, they will not have dull percussion, note, and they will not have decreased chest wall movements. That particular picture you will not see in patients with a pulmonary embolism. So even your pulmonary embolism is also ruled out. So what is the most likely diagnosis in this particular patient? That is your right-sided pleural effusion. Right. So this is a short video on discussing and ruling out the other options on the topic of dyspnea, that is shortness of breath. So I hope you might have liked this particular short video, and please follow us on the daily dose for the daily updates.